That's your yoga pants that are that way, right?
What is? Oh yeah, they're off.
The yoga pants are throwing me off. All right, so just take a couple steps in place. Yep. And do you not want me to say you're pregnant, or
I don't care.
you don't care? Okay. So she's 15 weeks pregnant. She doesn't even.
There's nothing there. It's a little bit.
I look more pregnant than you. You'll hear me say this a lot. Okay, I'll just stand behind her. She's got a left high shoulder, okay, and her pelvis is translated to the right. I think we might have a right post. No, which side is the one that hurts you? This one, right? The left?
Mm-hmm.
Okay, she's 15 weeks pregnant. She's rolled over in the bed and she thinks she pulled something.
Mm-hmm. I was trying to crack my back on my own.
Right, we're not supposed to do that. This is the result. This is what happens. You gotta get professionally cracked. I need to watch you walk around the room a little bit.
Okay.
This is what chiropractic students, this is what you call a gait analysis. Go ahead. And you're like, oh my God, everybody watches me walk. Yep, and then come on back.
Should I do like a runway walk?
You can. You can. Well, what's funny is go ahead, come on and do it one more time. Actually, you're not too bad. I always joke because people think that they look so sexy on the runway. You know, all I can see is a misaligned pelvis, a left high shoulder, a drooped, sagging right shoulder. On your back, face up for me. You said you've been getting some headaches, right?
Yes.
Do you notice that they have a side?
The left side? More
The
so,
left side?
but mainly, it just ends up being the whole back.
Do you have a headache right now at all?
Slightly, but not bad.
It's more pressure than it would normally be because
You look
do I look funny
like
upside down?
yes.
Don't look at me then. It's like, wait, you're now I know why everybody laughs.
Like,
Your mouth is where your eyes should be. Any pain when I do that?
yes.
Do you?
That's where I feel like the headache comes from.
Okay. So there's a little groove in here that a nerve exits.
Yeah.
And you've got to like mash that down
Mm-hmm.
because it just gets congested.
Oh, that hurts.
Is it
yeah,
too
all
much?
in there. No, it's
Like,
that's where it's coming from.
oh, I'm sorry. When you're feeling around in the skull, you'll feel this divot here. And that's where the occipital nerve exits. And that's where a lot of people get their headaches are stemming from, right in here. Right there. And she's just saying that's super, super sore. It comes from having a right atlas on this side, which is a segment lower down here. Okay, stiffness here causes the occiput to go out over here. If I try the same occipital nerve, it's on both sides. You're even on, okay, here it is on this side. Do you want me to go on the inside?
And that doesn't hurt as bad.
No, it's okay. Yeah, there it is on that side. So this isn't as bad as the left-hand side.
No, nowhere near.
Yeah, I'm right in there and she's not screaming. So, and then I go on here and,
Yep, there it is.
ow. Chiropractors, we all have our different styles. And this is mine. Starting to loosen up. Check the T1 rib. Little bit of tension in there. Okay, here we go. We're gonna go backing up like that. That's it. Starting to loosen up. Oh, I still have to work on the occiput, but this little spot over here.
Mm-hmm.
But if I can get this to rock under, it'll take some of the slack off of the occiput.
Good.
You're like, okay, whatever you say. it'll make sense in a second. It's like watching Game of Thrones, like we just went through. She's not a Game of Thrones fan. She doesn't understand. She thinks we're all crazy. So I showed her one scene. So just for family members out there, I was just thinking about this. She's like, I still don't know if I'm convinced. Take like the good scenes from Game of Thrones and have them watch those first. Then though I want to go back and watch all the rest.
Who do I start with? What was her name?
Daenerys.
Daenerys.
Or Khaleesi. The blonde girl. The girl with the white blonde hair.
Gotcha.
Right out the atlas. This is probably one you can't get. Right here. Think thoughts here. Good. Perfect. Come on up. Doing okay?
Mm-hmm.
I think I got it all. There feels like there's a lot left here. In there. And there's like you go for it and you see how much of it is gonna go into place. And then sometimes you get it all in one shot, sometimes you don't. You gotta come back and do it again. Right here. There we go. So that was everything. All right. And go back and check. Proprioception. This tells me a lot about a person. Whew. Some loose toes. Except for the first one. Any pain when I do that? No. Not sure if you can tell it this side's a little. Do you feel like your right leg is less flexible than your?
I don't know.
Yeah, this side has more flexibility. You know, all the little bones back. There we go. Okay, like this. Your pelvis is here, and you let your belly drop down in here in this space. Okay, so your hip bones here go right at the edge.
Okay.
Perfect. You got it. There's your air hole. There we go. Right? How does that feel? Feel okay?
Good.
All right, yeah, we've got lateral curvature over here.
Yeah, it's kind of tender.
Getting a little easier.
It is.
You're really tight in your mid-back. I'm feeling the congestion over there on the right.
Yeah, I feel that.
Yeah. She has a couple of ribs out over here. So even though she has a left high shoulder, T3 and T2 are just really sitting high. So here we go. Deep breath in. All the way out. Perfect. Again. Doing all right.
Oh, yeah.
The baby is way down in here. Okay, I'm not putting any pressure on the baby. She's doing good. Deep breath in. All the way up. Good. Okay. Wanted to get that rib that is just giving me some resistance. Back to the roller. Oh, I think that's all it wants to go. All right. So it's right here. I'm on the side of the SI joint. If you go directly on it, that hurts.
Mm-hmm.
So you go right to the side of it. Like right in that groove there. And you let me know, okay? Are you okay?
It's good.
Like, breathe. That is a huge piece of scar tissue right there. And we don't want you to have a problematic birth because this SI joint doesn't open up. The sacrum will float away when the baby comes through, and we don't want anything giving you, like anything catching. Still got time. This side okay?
Mm-hmm.
All right, I'm gonna go a little bit more deeper. You doing okay?
I am. It doesn't hurt as bad as it did.
Yeah, it'll loosen up. Oh, there it is. Okay.
What was that?
That's the SI joint. You just got a lump of scar tissue there. I'm going to feel it right now and see what it feels like to my hand, the texture of it. It might be something you had, and then you're pregnant, and it kind of made that area more flexible because of all the hormones, the relaxin.
Mm-hmm.
And now it just reopened. You know, you busted open an old scar. You crack those end plates. Ugh. Causes problems down the road. Yeah. That is just... Okay, so here's, the sacrum will start, on a pregnant lady, will start to lift up this way. That's all normal. The sacrum is like this, and it starts to lift up like that. And in labor, you'll actually see the sacrum come up. As her pelvis expands for making room for the baby, we've got to make sure that this TFL muscle here is relaxed. Because she was pointing to up here. She had a big piece of scar tissue here. This is where it was located.
Ooh.
Sorry. Is it tickle or is it painful?
It's a little tender.
A little tender. Okay. I gotta back off on this side.
It's getting better.
Yeah, I just have to start all over again on this side.
What is that? Why is that so tender?
There's a nerve right here. Remember this discussion we had before? There's nerves. That's my focus. Okay, the nerve in the joint.
Gotcha.
And I clean those out. It feels like muscle, but really it's connective tissue. This is a nerve though, and it gets trapped.
Wow.
And if you don't release it, it goes down into the side of your leg. And it doesn't allow me to relax the pelvis. So our cultures are just so different. Like in Miami, it's the same way. Everybody's like, it's hot.
Mm-hmm.
Everybody wants to be fully dressed.
And you want to be tan.
How much vitamin D are you getting?
Not enough.
Yeah, I can tell that you do tan.
Mm-hmm.
You're like me. You can tan.
Yes.
You're not... I have a brother that can't tan and a father that can't tan, so... I know how that is. But if you can tan, then you need sun.
Yes.
Even my brother, I tell him, I'm like, get 3 minutes a day. Just do a flash bake, and then come back in. That's all you need. Just to get a little bit of vitamin D. Because otherwise he has to like slather himself with sunscreen, and that blocks out all of the beneficial rays.
Yeah, that's tender right there.
Oh, I'm sorry.
That's good. I can handle it.
Okay.
But you told me to tell you.
Yes, no, I needed to back off. That's all. No, you can't suffer in silence. That's not acceptable. Some people they won't tell me anything, and I'm like, you're not breathing. Okay, I'll back off. They're like, no, just get it. Like, no. It doesn't work like that. We did get this to move, though. It just didn't move. It's still subluxated. And everybody's like, skin cancer. I'm like, you will get cancer if you bake. I'm talking like 15 minutes, without suntan. She can handle 15 minutes in the sun.
Oh, yeah.
Not everybody can handle 15 minutes in the sun, so you have to test it. You have to go out there and wait until you get that little bit of pink, and then you cut that time in half.
I rarely burn anyways.
Oh, no. Oh, my goodness. No arm pain?
Yeah, a little bit.
I've got to work on this spot right here. It's just really super tight.
I feel like this is gonna hurt.
No, you're like, I'm warming it up. I won't use my elbow on you, okay? Not today. Not today. No, no, I'll warm it up. If it does, you let me know. Does that hurt?
No.
Does that hurt?
Nope.
Here we go. See if you can handle a little more.
Oh yeah, that's good.
A little more. That's about all I'll do. Yeah, I'm just trying to... When somebody has a swollen low back like this, and I do believe... Here, come on, like, real close. Okay, not sure if you can tell on the camera, but when I push here, I know you can feel it. Okay, it just doesn't have the... This has way more spring in it. This is much less swollen here than this side. Oh, the whole side. And especially right here, she's bad. So that can also radiate and give her SI joint symptoms. However, if it wasn't for the fact that I found that scar tissue there, I might think it was from this. So you gotta check both points. Sometimes when something's swollen down here, it can give like kind of sparks and it makes like this scar tissue, but I don't think so. I think it's just the whole pelvis here is tight. I still think it's an injury. All right, here we go. So I'm just trying to traction, take the mid back. No, I don't want to put pressure here on the low back. That hurts. It's too much flexion for the low back. You jam the facets. So you come up into the thoracic region, and I kind of grab onto the whole rib cage basically and just push up. The plane of these joints are angled this way, okay? And so I've got to go up here. It feels good to come up. It doesn't feel that great when you're pushing against the joints and you're opening them up. I'm trying to close those joints down. Open up her lower back region. There we go. Just, yeah. There we go. So if I can get this region to open up, her low back will just by default feel better. Ooh, and it's up into here.
Yeah, it's tender on the right side there.
Yeah, it's just this whole region from here to here is just really tender on her.
Yeah, like right there.
Yeah, that's the apex. This could be from sitting. Could be just making room for baby, and subluxations are making their presence known. Bounce on the joints. You see how I'm going over the joints?
Mm-hmm.
But I'm right on the side. I'm not directly on top of her spine. I'm right on this right. I put my piezoform right over the side of the spine here and go up.
I felt it.
You just Just trying to close these down. Just get it to that's all I'm gonna get, I think. And this one's out over here, so I always say that when there's a lateral curvature there's always one on the other side. And my line of drive is up and over it and pushing it down. We're gonna work on this rib over here. Whee! Go back down, close it. Yeah, don't forget underneath the scapula. Don't forget. Okay. And then back down, other arm.
That side doesn't hurt as bad.
Isn't that funny? Because this is where all the rib heads are out.
Mm-hmm.
I know. Took me a while to figure that out. I was like, wait, why is always the side that the rib heads are out underneath the scapula doesn't have that much problems? And I was like, oh, it's because it's making up for it. You know, one side's is popped out, one side's compressed.
Mm-hmm.
So this is the compressed side, this is the busted side. In layman's terms, I can't think of any other way to put it. Very good. We'll go down for good measure. Okay, no, there's nothing there. So here we go. I won't use my elbow, I'm using my hand. Sorry. Okay, good. Ooh, goosebumps. Is it kind of swollen? Or is it sore?
No, it's good.
And then you're gonna kind of look back a little bit. Sorry, I'm getting like the hair. There we go. I'll pull your hair. But it's right there. That's why you're getting the headaches.